Yeah.
and looking at, toxic load, at urinary organic acids, at nutritional levels, at
Yeah.
methylation, and all these genes that are in combination. I've often said that environment is a big factor, but genes load the gun, the environment pulls the trigger.
Yeah.
So it's this sort of interplay environment across these kids' genetics. And I've seen this, I've seen all these different genetic patterns of low glutathione genes and methylation genes and detoxification genes that are really common in these kids, and they tend to be sort of at risk. And I think, one of the things that really struck me when I started learning about this was the work of Martha Herbert. And I'm sure is another Harvard
Yes.
neurologist who studied autism.
And brain imaging.
Yeah, and she talked about these biopsy studies on kids who accidentally died with autism. And all these kids have massive amounts of neuroinflammation. Their brains are on fire. And when your brain is on fire, it's hard for it to function. And Alzheimer's is a brain on fire. Depression, we now know, is a brain on fire, right? Schizophrenia, we now know, is a brain on fire. So what's causing the fire?
Yeah. Well, we actually, prior to establishing Cortica, I was on faculty at Columbia University, and we had an NIH-funded research program using multimodal brain MRI to study autism in children and adults. And one of the research studies that we published showed that there was a pattern of neurochemistry, essentially, that really pointed to both mitochondrial dysfunction and inflammation in the brain. And as a neurologist, when I think about inflammation in the brain, there are kind of, there's sort of a set of maybe more acute or sudden onset fulminant types of brain inflammation. And then there's this other category of more low-grade, chronic, smoldering types of inflammation. And the research is really pointing to autism falling within that second category.